Good evening, guys. I have a bonus show for you. It is discussion E, and it is discussing engaging in lifelong, mentally stimulating activities, especially reading, writing, learning languages, and similar cognitive enrichment was associated with about a 38 to 39% lower risk of Alzheimer's disease in long-term study. In a recent long-term study. Study summary. Researchers followed 1,939 older adults, average age 80, for about 8 years and scored participants on lifetime cognitive enrichment, childhood, midlife, and later life activities. Those in the top 10% of lifetime enrichment had a 38% lower risk of Alzheimer's disease and a 36% lower risk of mild cognitive impairment compared with the bottom 10%. The high enrichment group also developed Alzheimer's about 5 years later on average. What this one thing means in practice. Cognitive enrichment in the study included childhood exposure, being read to, access to books, learning foreign language, midlife activities, library membership, museum visits, regular reading, late life activities, frequent reading, writing, playing games, language use. The headline, one thing, therefore, refers to consistent lifelong engagement in mentally stimulating activities, not a single isolated action. How strong is the evidence? Large, long follow-up. Nearly 2,000 participants tracked for 8 years. Observational design. The study shows an association, not proof or causation. Other factors: lifestyle, social economic status, health may contribute. The authors adjusted for some confounders and found the enrichment effect persisted, but residual confounding is possible. Practical evidence-based steps to apply now. Read regularly, books, newspapers, long articles. Write, journaling, letters, creative writing. Learn or use language. Study a new language or keep using one you know. Play mentally engagement games. chess, crosswords, strategy games, combined with social and physical activity for broader brain health benefits. These habits are low risk and scalable across ages. Limitations and cautions. Not a guaranteed prevention. The reduction is statistical. Some people with higher enrichment still developed Alzheimer's. Timing matters. Benefits were strongest when enrichment spanned the life course. Starting late may still help, but likely less than lifelong engagement. Complementary measures. Manage cardiovascular risk factors. Stay physically active. Maintain social ties and follow medical advice. These also affect dementia risk. Bottom line, sustained lifelong mental stimulation, reading, writing, language, learning games is associated with roughly 38 to 39% lower Alzheimer's risk, and delayed onset is a practical low risk strategy worth adopting alongside other healthy habits. Lifelong cognitive enrichment, regular reading, writing, language learning, and other mentally stimulating activities across childhood, midlife, and later life was associated with about a 38% lower risk of Alzheimer's disease and a delay in symptom onset by several years. Study summary. Researchers followed 1,939 adults, average age 80, for about 8 years, and scored lifetime cognitive enrichment across 3 life stages. Those in the top 10% of enrichment had a 38% lower risk of Alzheimer's disease and a 36% lower risk of mild cognitive impairment versus the bottom 10% and developed Alzheimer's. Roughly 5 years later, on average, American Academy of Neurology Science Daily. What the headline actually means. One thing, sustained lifelong learning and mental stimulation, not a single pill or one-off activity. The study's enrichment score included childhood exposure, being read to, books at home, learning language, midlife resources, libraries, cards, museums, visits, and late life activities, reading, writing, games, quick guide to action. Key considerations: start early, keep going. Benefits were strongest when enrichment spanned the life course. Combine approaches, pair cognitive activities with physical exercise, social engagement, and cardiovascular risk in management. Practical steps: read daily, books, life form articles, newspapers, write, journaling, or creative writing. Learn or use language, classes, apps, conversation, groups, play strategy games, chess, crosswords, puzzles. Visit cultural venues, museums, libraries. Observational association, not proof of causation. The study adjusted for factors like education and societal economic status, but residual continuing confounding remains possible. Effect described as cognitive resilience. Higher enrichment was linked to better memory and slower decline, even when brain pathology, amyloid tau was present, suggesting enriched activities helps brain cope with disease related changes. Population studied, average age 80 at baseline. Results may not generalize to all groups. Risks, trade offs, and realistic expectations. No guaranteed prevention. Statistical risk reduction does not mean immunity. Some highly enriched people still develop Alzheimer's. Equity issue: access to enriching resources in childhood and midlife matters. Public health effort to expand access could be important. Sustained lifelong mental stimulation is a low risk, evidence backed strategy associated with substantial reduction in Alzheimer's risk and delayed onset. It's best used alongside physical health measures and social engagement, lifelong cognitive enrichment, regular reading, writing, language learning, and other mentally stimulating activities across childhood, midlife, and later life was associated with about a 38% lower risk of Alzheimer's disease and a delay in symptom onset by several years in a large longitudinal study. Study snapshots. What the researchers did. The study followed 1,939 adults, mean age 80, for 8 years, scoring each person's lifetime cognitive enrichment across childhood, midlife, and late life. Key findings: people in the top 10% of lifetime enrichment had a 38% lower risk of Alzheimer's disease, a 36% lower risk of mild cognitive impairment, developed Alzheimer's about 5 years later, and developed MCI about 7 years later than those in the bottom 10%. What lifelong learning meant in the study. Early life being read to, books, newspaper, atlases at home, studying a foreign language for 5 years, midlife library cards, magazines, subscriptions, museum visits, household resources, late life, frequent reading, writing, playing intellectually stimulating games, chess, puzzles. How long is the evidence? Association, not proof of causation. The study adjusted for age, sex, and education, but remains observational. Unmeasured factors. Could contribute. Biological insight. Brain tissue analysis suggested people with higher enrichment showed cognitive resilience, better memory, and slower decline, even when Alzheimer's pathology, amyloid tau, was present. This supports the idea enrichment helps the brain cope with damage rather than preventing pathology entirely. Practical evidence-based steps you can start now. Aim for sustained varied mental stimulation across life stages. Read daily. Long articles, newspapers. Write regularly, journaling, letters, creative writing. Learn or use language, classes, apps, conversation groups. Play strategy games, chess, crossword, logic puzzles. Visit cultural venues, libraries, museums, and combine cognitive activity with social and physical exercise for broader brain health benefits. Okay, guys, that is your bonus discussion for tonight. I will try and do one for tomorrow, or maybe jump on Sunday before I go to dinner. So I will see what I can do for shows Till then, Gator Wellness, take care, folks.